This is Clarksdale, in the heart of the Mississippi Delta, where the U.S. Army, under the direction of the Department of Defense, is expanding a great ongoing effort. For 2 weeks, American citizens receive health care at no expense. Coahoma County is the first in a new set of missions to benefit from this Deployment Readiness program. The Pentagon identified a need to effectively train reserves as they are frequently activated. A concept that had been developed was innovative readiness training. The strategy would be real-world exercises in a civil-military model. As a result, we would have a mutually beneficial arrangement by which both the civil communities can receive various medical services and the military can get the required field training that would have them ready to go. Historically, the Department of Defense has deployed reserve missions to various parts of the world to provide medical attention, a crucial part of training. The medical troops exercise their deployment readiness prior to and in preparation of real combat deployment. Here they meet many of the logistical challenges that will be a part of real-world development, such as how to work with locals effectively, access the available resources at the location, equipment, buildings, transportation, supplies, etc., where to set up the medical units, how to transport patients. More recently, the Department of Defense began deploying these missions on Native American reservations here in the lower 48, as well as in Alaska. Now they have begun expanding to other parts of the country, adding more benefit by targeting economically challenged areas. Clarksdale and Coahoma County would be the first in the U.S. meeting this criteria to receive the benefits of this program. When the Pentagon brought the possibility of a mission to the Delta Regional Authority, Federal Co-Chairman Pete Johnson could only jump on this great opportunity.
The Pentagon needs to retrain and keep trained a lot of their troops, especially their reserve troops. And through our relationships with our nation's military, we were able to work on an arrangement so that they could come down here to Clarksdale, Mississippi and train their troops. We're just so fortunate that they're able to provide medical care to the people of Clarksdale and Coahoma County.
In 2000, the Delta Regional Authority, or DRA, was created by Congress. It is one of 75 executive agencies of the President of the United States. It is charged with addressing the problems of economically distressed areas. The co-chairman is appointed by the President and works with the governors of the 8 states. The DRA national office is in Clarksdale, Mississippi. Its footprint covers 252 counties and parishes. The Department of Defense, in conjunction with the DRA, will begin the process of making this mission a reality. Ultimately, in 2009, the DRA will orchestrate efforts in both Clarksdale, Mississippi, and Hayneville, Alabama. Without a huge buy-in and effort from the city of Clarksdale under the leadership of Mayor Henry Espy, this mission could not have come to fruition. It took much cooperation between DRA and the city of Clarksdale for this to be the success that it has become. Clarksdale was able to recruit or collaborate with many organizations. The mission was staged at several locations provided by the city. Admissions were held at this nurses' training facility. Here, there would be more than adequate space to comfortably accommodate all of those waiting to have their appointments, shielded from the hot, humid Delta day. Services provided on this mission would be dental exams, dental services, eye exams, eyeglasses, all at no expense to the patient. Patients were asked to make appointments, however, walk-ins were accommodated as well. Once the patient was called from the waiting area, they would be shuttled by servicemen and women to a second building where 2 medical mobile units were parked. This building provided another small, comfortable waiting room in case the medical units got backed up. The first mobile unit was a dental unit, provided by the city and is owned by the state. The second unit was the optical unit, a rental provided by the Army. In the dental unit, the personnel delivered basic services such as cleanings, fillings, and extractions. For many, it may have been years since ever seeing a dentist, if ever. At the optical unit, patients would receive general eye exams, prescriptions for eyeglasses, and of course, eyeglasses for the young people. They were prepared to make as many as 300 pairs for this mission. A small example of the military's response capabilities came up only in the second day. It became apparent that there was as much or more of a need for adult glasses as for children. The Army was quick to respond by acquiring additional glasses for adults with the aid of the Lions Club. Once eye prescriptions were prepared, within hours they could be filled. Behind the secondary waiting room, a makeshift lab had been set up right on site. Additionally, the Army would also provide training to their veterinarian resources by providing care to the local animal shelter, which had been overwhelmed with its population of cats and dogs. In Hayneville, Alabama, in coordination with Mayor Eleanor Bell and city officials, the medical unit was able to deploy in front of the new town hall, a highly visible area where all would be most aware of the presence of the mission. Military personnel stayed right on site.
CBS 8 News is covering Lowndes County, where a U.S. Army Reserve medical unit from Texas is providing free health care to residents there. CBS 8 News reporter George McDonald has the story tonight from the CBS 8 West Alabama newsroom.
The 4005th Medical Hospital, a reserve unit out of Houston, Texas, has set up shop in Hayneville and are offering free medical service to anyone.
Everyone. No one will be turned away.
Lowndes County is a very depressed area, and there is such a need for health care here. We have high cases of diabetes, high blood pressure, high cholesterol, and with this service here, we're able to attack some of those things.
The Hayneville site had a much higher focus on primary care. Diagnostics included lab test, complete blood count, basic metabolic panel, urinalysis, and a lipid panel. Pharmacy services were received for diabetes, hyperglycemia, congestive heart failure, asthma, infections, and high blood pressure. Physical exams included minor suturing of lacerations, bandages, and advisory care. It is clear when you speak to both the civilians receiving the care and the military personnel, they are equally thrilled to be a part of these missions. In Clarksdale, Mississippi, a total of 792 patients were served, and a total of 451 animals were served. Number of vision exams, 300. Number of glasses made, 30. Number of glasses to be mailed out, 40. Number of glasses donated by the Lions Club, 82 pair. There were 492 dental patients provided for, which included 256 cleanings and 81 fillings or extractions. 452 animals were treated for fleas and ticks. 51 animals were sterilized. In Hayneville, Alabama, 787 patients were seen, 90 children, and 697 adults. 499 lab screenings took place, and 282 EKGs were performed. 404 pharmacy prescriptions were filled. One can't help but feel good when the concert of efforts by the Department of Defense, U.S. Army, the DRA, and the cities of Clarksdale and Hayneville can make such a huge difference in the lives of U.S. citizens.